Welcome to another edition of Modern Aesthetics Journal Club. I'm Dr. Rebecca Kazin, here with Dr. Jody Comstock, who is a cosmetic and procedural dermatologist from Tucson, Arizona, with over 25 years of clinical experience, and we're really happy to have you here today. Welcome.
Thank you, Rebecca.
So I think we're going to talk about neuromodulators in general and all of the fun new ways that they're being used, which many of them are off-label, so we'll say that outright. So what are these new and fun uses that are under investigation and being used practically?
Well, neuromodulators are used everywhere throughout the United States and worldwide. Worldwide, over 3.1 billion medical experiences with them. And so we see a lot of cosmetic uses, but also we're seeing use for arthritis, migraines, cerebral palsy, and we're seeing some investigative work with also acne, psoriasis, some even hair loss and other sweating on other areas of the body.
Usage for inflammatory conditions like acne and psoriasis, what is the theory behind that?
I think the theory is that it's an anti-inflammatory, and we may see some lessening of redness. We may see some other immunological effects from it, and some of the effects we really don't know.
Interesting. I've heard this term meso Botox, even though Botox is a brand, but meso neuromodulator. Can you tell us about that?
So oftentimes our counterparts in Canada and Europe are doing things a little bit ahead of the game as far as the doctors in the United States. And so meso mix refers to mixing a neuromodulator with a filler, so that you might take your filler, say a 100-unit vial, and put 10 cc's in versus maybe 1 to 3 cc's. So you get this very dilute, so 0.1 cc of unit of a volume would equal 0.1 cc, 1 unit of a neuromodulator. And when you mix this 1-to-1 with a filler, that 0.1 cc's is a half a unit of Botox or any other neuromodulator. And when you mix this together, it may have an effect of helping shrink the pores, help soften the muscle movement, and give a global glow to the skin.
How is that administered?
And so it would be injected. So you would mix up your neuromodulator and then use a transfuser. They're called a female-to-female transducer. And you mix the product together, and then you would inject it into the skin.
As you would inject filler?
Correct.
Okay, got
and
it.
it is just as though it has filler in it, but you've mixed in your neuromodulator.
Do you worry about secondary, effects on the muscle that could alter facial expression?
And I think that whenever you're using a neuromodulator, you always worry about weakening the muscle. When it's so dilute, it doesn't seem to weaken the muscle, but just soften and give a very nice glow to the skin.
Interesting. Are you injecting the filler more superficially then?
Yes, and when you're doing this, it's usually using a cannula or some sort of threading type of injection. It's really quite beautiful, and it just gives this secondary lift that's hard to explain.
I like that. I'm going to try that. Other things that I've heard are more usages along the jawline and the neck. I know that's a problem for a lot of people.
Yes, and I think we're really seeing the trend. As we've mastered the face, people are moving down to the jawline and the neck. And so one of the things I love using, and I've done more in the last year, is doing the glands. So the submandibular glands and the parotid glands, really carefully assessing your patients to see if they have a little bulge in that area. And when you inject the glands, you tend to get some atrophy of those glands. And you want to be careful checking salivary secretion so that you're not making a dry mouth. But if you use a small amount, maybe 4 to 10 units, you can actually shrink the glands, which helps even out the jawline. So I love the glandular injection. And then just along the jawline and along the neck and in the bands, you can do your little injections, maybe 2 units per injection every centimeter. And you can do this along the neck. And then we sometimes hyperdilute your neuromodulator, maybe 5 times or even 2 to 5 times as dilute, and do microinjections about every centimeter. Really softens necklace lines and the whole neck area, giving a light lift.
Interesting. So I knew about the bands and about sort of the Nefertiti lift, but as far as the necklace lines, it does work with that?
Yes, just on the whole area. And then again, using that little meso mix in the necklace lines is also lovely. Taking a little bit of filler, a little dilute neuromodulator, and injecting along those necklace lines is lovely.
Thank you so much for coming. This was a very interesting and informative conversation. And thank you again for joining us for this episode of Modern Aesthetics Journal Club.